All right, so we are going to insert an IV and initiate IV fluids. So I'm going to gather my supplies. I'm going to grab my IV fluids. We are going to grab our IV tubing, our IV extension sets, our IV needle, a tourniquet, a 10 milliliter flush, a Tegaderm, alcohol prep pads, tape, and IV tubing label. All right, I'm gonna get my IV fluids and tubing primed, ready to go before we initiate our IV. So we have our sodium chloride. And then I have my IV tubing. So this tubing is really long. You want to be careful as you open it that you don't just let it go, because we do not want it on the ground for infection purposes. So I have to prime my tubing, meaning I have to get the sodium chloride into my actual IV tubing. One thing I need to be aware of is closing the clamp before we begin, because we don't want to mess all over the floor. So we want to maintain this sterile to sterile. So we need to take our IV bag. We're going to pull that cap right out. We want to make sure nothing touches that. And then we're going to take off the top of the spike. This is sharp. It does stab through the plastic. This is probably going to be the hardest IV bag that you ever spike. It's just hard plastic. Once you puncture into there, it's going to start leaking. So you want to make sure that you spike it nice and smooth so you don't get a mess. All right, we're going to squeeze the barrel, fill up the chamber about halfway, and then we're going to prime through. So we have our little basin here, just so we don't make a mess. We're going to keep this capped, and we are going to slowly open the clamp, and we're gonna watch the the sodium chloride flow through the tubing. I see my bubbles at the end. I wanna make sure my bubbles are out. And then, one more bubble. Perfect. All right, so my tubing is primed, and now I'm just gonna hang it right up there so it is ready to go. For when I'm ready, I'm going to label my IV tubing, the start time, and our discard date within 24 hours, but it's whatever your facility says to do. And I'm going to hook this right on to my tubing. All right, I'm gonna demonstrate how to put a tourniquet onto Judy's arm. We wanna make sure that our tourniquet remains flat against the skin. We give it a little pull, you cross, and you always wanna make sure that you're on the skin. You don't wanna do it over sleeves. You just end up doing a little bunny tuck there. And then we wait for all of those veins to pop out.
And if you're having trouble, have the patient hang their arm down and maybe make a fist. Look at those veins.
So the whole purpose of tying it this way is so when we're done, we're able to just grab our little end point and just give it a pull, and it pops the tourniquet. Right, before I put the IV in, I do have to prime my IV extension set. We don't want to push a bunch of air into our IV line. So I'm going to open this up. We'll leave it right there. we're going to scrub the hub for 10 to 15 seconds. Okay. So now I want to be careful. I don't want to set this back down again because I just cleaned it. I'm going to take my 10 cc syringe. You push in and then you twist it on. All right, make sure that you're twisting the 10 cc syringe and not the actual tubing. And then you're going to just flush that saline right through, and you're going to leave it attached just like this. Leave that end cap on because that's what's keeping it sterile. All right, I'm going to get everything open and ready to go so I can prepare to insert my IV needle. I'm going to open up my Tegaderm so it is ready to go. I'm going to put the date on here, right where it says the date, and I'm going to put my initials. All right, and I do have my IV catheter that I'm going to open up also. All right, and I am ready to go. Let's go ahead and insert this IV. I'm going to tie my tourniquet around my forearm because I am starting down here in the hand. If I was going to be up in the forearm or in what we call our antecubital inside of our elbow, I would tie up here over the bicep. So I'm going to tie my tourniquet, and I'm going to let those veins pop up. And I found one right here in our hand, so I'm going to scrub the site, up, down, side to side, whatever. Okay. And we are going to let that dry because we've all put alcohol in our open cuts before. So I have my IV needle. What we do is we take the top off. Okay. And the needle is what's going to go into the patient, and then once we get the needle in, we are going to end up sliding this catheter upwards. So there's a little notch. Can you get that notch where it pushes once we get it in?
Yep.
Okay. All right, so I don't want to touch this area again. I want to be aware of what's sterile. I'm going to use my thumb to secure my vein down at the bottom so it doesn't move, and I'm going to go right on in. Once I get into the vein, I'm going to advance my catheter forward.
And in a human arm, you will see blood back right up into it if you're in the vein.
So there it is. And then it snaps. So after it snaps, that locks your needle into place. So now we have to be ready. We're gonna take this off. The benefit is our new cannulas, they have a lock in them so the blood doesn't come pouring out. Then we're going to twist that off and twist that on. And then I usually give this a little pull to let the blood go through. So we have this. We're going to make sure that we're able to flush through about 3 milliliters. It's a good flush. So I'm going to secure my IV into place. All right, and I wrote my little initials and the time on this piece of tape here, and I'm going to just stick it right on the IV. One more. I have my tape. And all I want to do is secure this extension tubing in place. It's a little awkward where it is. in those hands, but if I can make sure my patients can still clean their hands. And the big thing is I don't want to cover where the insertion site is into the IV, because I need to be able to assess that site every shift while this IV is in place. All right, my IV is in, and I did flush my IV just before I disconnected it because I'm getting ready to hang up these IV fluids. If you are hanging up the IV fluids before you flush the IV, you do need to go and flush this IV with 3 milliliters of saline before hooking up the IV fluids. So because I disconnected everything, I am going to scrub my hub again because I want to make sure there are no pathogens before I connect it. We don't need to give them a direct route to the bloodstream. So keep a hold of this. We don't want it to fall down and contaminate. So I do have my IV fluids, where my IV fluid line that I'm going to hook up to my extension tubing. I'm going to screw that off, make sure that we're going connection to a connection and I'm not contaminating it. And that is it. And then we're going to get these IV fluids started. So I'm going to slowly unclamp